Hi, it's Dr. Weiner here, and I'm very excited to give you a 1-year follow-up on our cheek challenge. To refresh your memory, the cheek challenge was challenging Restylane Lyft, which I put on her right side a year ago, 3 syringes, versus Voluma, 3 syringes on this side. And so we're here for a 1-year follow-up. We've been taking serial pictures throughout. And we're going to discuss the findings that we have shown in this 1 year. So I'm going to ask the patient, at this point, if you had to give a percentage of how much filler you think is left, how much would you say on the right side?
Probably maybe 5 to 10%. I think it's mostly, for the most part, is gone. Yeah.
You're basically back to your baseline.
I think so.
Okay. And how about the other side? About the same?
About the same.
Yeah.
Not a significant difference, I wouldn't
Right.
say.
So both sides, the Voluma side and the Restylane Lyft side, our patient stays is about the same as when she started a year ago. So that's a 1-year duration for our fillers. Maybe there's 5 to 10% left, but it's not giving you much correction at that point. And how was your 1 year with these fillers? Was it any different between the two sides or about the same?
About the same. I didn't notice that one side was noticeably fuller, or I never noticed really any significant difference.
Right. She has a little asymmetry to start with, and we're back to the asymmetry that she had before. But what I wanted to sort of question is that Restylane Lyft is FDA approved to say it's a 1-year filler, and Voluma, which was on the left, is FDA approved to say up to 2 years. But in my experience, it has shown that Voluma is probably similar to the other side, a 1-year filler, maybe a little bit longer than that. I think HA fillers just last approximately 9 to 12 months, maybe a month or two longer, but most HA fillers are going to last you that amount of time when you're put in the cheeks. And if you want to come over here, I have some 3D pictures that we've done that are very interesting too. So this is a 3D picture using the Vectra system. And this is the before we started, and this is the after. And this is the Restylane Lyft side. And if you look, there's some very minor changes that you can see on these. There's perhaps a little less of this crease here in the nasolabial fold. And maybe there's a little more fullness in the submalar area over here. But overall, we're basically where we started on the Restylane Lyft side. You can see the jowls are still about the same. In the interim pictures, the jowls were lifted up by the cheek filler. So now we'll go over to the opposite side. Okay, this is the Voluma side. And as you can tell, maybe there's some slight more fullness in the submalar area, but no significant differences between the two sides. The jowling is similar as well, so it says the lifting has come down. So the tear troughs look the same, the projection on the lateral malar area, and we'll do a straight on view too. And you can see that the cheek looks very similar on the sides there on both sides. We can do this OG curve, what they talk about, which is this curve right here. And it's the same on both sides, on the Restylane Lyft side. And then we look on the opposite side. Again, this is the OG curve. And you can see that the OG curve is identical on both sides. So therefore, what I'm trying to say is that both sides look very similar. This is another view of the areas that are in question. And it's very hard to discern the differences between the two sides on these pictures. You see a little bit less in the submental area. She did get Kybella during this 1 year, and that's the effects of Kybella. So basically, what we can conclude is that our 1-year cheek challenge did tell us something. What it did say is that basically the Restylane Lyft and Voluma acted similarly in the patient, and their duration appeared to be similar. So it's about a 1 year, maybe a little bit longer duration in both fillers, but they're basically the same duration. So that's our conclusion from the cheek challenge. Now we have to ask the other cheek challenge doctors what their results were. Thank you very much for following us. This is Dr. Weiner signing off.